Thank you, Mr. President. At this time, I take this opportunity to warmly congratulate you on your elevation to President of this Honorable House. I know you will always strive to apply wisdom, neutrality, and rationality in your management. Congratulations, Mr. President. I also want to say congratulations to the 4 new senators, independent senators, one of whom is my colleague, Professor Gerard Hutchinson, who we worked together at the University of the West Indies for years. I wish them a successful journey in their political and parliamentary career. It is my immense pleasure to once more join all members of this House in a very significant task of debating the annual budget, which, as we all know, is perhaps the most important policy document of a government in its running of a country. I want to sincerely thank the opposition leader, the brilliant and compassionate Honorable Kamla Persad-Bissessar, for affording me the opportunity to speak in this august chamber. Honorable President, it is a very painful issue to see yesterday circulating on blog sites rumors of the former Prime Minister, present leader of the opposition, and soon to be next Prime Minister again. There's no doubt about it, the people are speaking, of the vicious rumors perpetrated, we understand, by paid bloggers. And we ask, who are these paid bloggers? Is the paid blogger one of them being supported and paid by this government?
46-1, we are debating the appropriation bill.
NLC.
Well, okay. So, Senator Mark, a point of order has been raised, and I'm about to rule on such. Senator, you've just begun your contribution. We are dealing with what is commonly known as the budget process before us. Make sure you tie it into that. And I understand that you're creating a context, but you need to be relevant. Continue.
For the guidance, Honorable President. It is in the context of the expenditure of the Ministry of Finance and the National Control Lotteries Board to be paying one of the bloggers in Trinidad and Tobago who continue to spread rumors, false rumors. And we ask, what is the government doing about that? We understand that there are certain bloggers who are being paid by the state, and this is money coming out from the budgetary allocation for this year as well, and came out from last year as well. So what is the government doing about it in terms of the viciousness and the dirtiness that is being spread by this paid blogger? And the Ministry of Finance has a lot of explanations to give, and particularly the National Control Lotteries Board, which has an expenditure on it as well. So I thank the Honourable Opposition Leader, and I want to briefly comment on a news item in the media today, which reflects ongoing malicious falsehood and propaganda against her. Every
Mr.
week
President,
in recent months,
point of order. Mr. President, 46-1.
One second.
Mr. President.
No. Senator Gopeesingh. Senator, no. No, Senator Gopeesingh, number one, when I am on my legs, there's no commentary to come across the floor. Number two, we do not make the kind of comments that you just made, even as you took your seat, across the floor. Number three, when a member raises to their legs to raise a point of order, they are allowed to do so that I can hear it. The member speaking is to take their seat so that said point of order could be raised. I then rule on that said point of order, and we continue as according to the process. Member, raise your point of order.
Thank you very much, Mr. President. Perhaps I didn't make myself clear previously. We are debating the Appropriation Bill 2023 for the service of the Republic of Trinidad and Tobago for the fiscal year 2024. That, in my opinion, is 46.1 irrelevant.
Okay. So, Senator Mark, I have already spoken as to the procedure. That is what we're doing. Senator, I am listening to what you're saying. I have already indicated that you are within the early parts of your contribution. However, it must remain relevant to what is before us. So be very careful about the line that you're going down and what you're saying, because I'm listening for the context to tie in to the budgetary process that we're going through. Continue.
I'm always guided by the chair, Honorable President. I'm guided, but he's so short I didn't even see when he stood up.
Have a seat. All right, Senator Gopeesingh. You are a seasoned politician in the parliament, the entire parliament of Trinidad and Tobago. You are well aware that those comments won't pass muster. So just temper them and continue your contribution.
Mr. President, it is important for us to speak as parliamentarians on the issues that occur nationally and what guides people's behavior, and we should be the forerunners in terms of making examples of what should be out there in the public. And when we facilitate and support things that are wrong and radically wrong, we hold ourselves in shame. I, as a medical doctor for 49 years, I cannot come to this parliament today without commenting on my colleague, the leader of government business on the other side, Minister Amory Brown, my two colleagues here, Senator Dr. Maria Dillon Rayleigh and Senator Professor Gerard Hutchinson. We all stand by a Hippocratic oath, and we uphold the dignity of the profession and medicine. When people are in the national community begin to go down the road of making media trolls and attempting to spread blatant, very disturbing untruths about
Mr. President,
the person's health.
On a point of order, as a colleague of the Honourable Senator opposite, 46.1, what he's presenting is not relevant to the appropriation bill.
Okay. Senator Mark, I'm not going to continue to ask for the process to be adhered to. Again, for the very last time, standing order is raised, I rule, and the process continues. So, Senator, as we've indicated before, there is a whole budgetary process, documents, statements. So far, every senator I've spoken to, things that have been said in the statement, or in rebuttal to comments that have been made before by senators that have spoken. I understand that you're creating that context, but where you seem to be heading has not been spoken to before, based on what I have heard since I've been here, nor have I heard it in terms of the budgetary statement. So even though you're creating that context, it must be relevant to what is before us. Understood?
So, Honorable President, am I not able to speak on an issue which I saw in the newspaper today, which revolves around the whole aspect of the budget debate?
So, one, we don't brandish the papers. Two, you need to make that connection. So, all I'm hearing is you're speaking to an issue that is in the papers today. I haven't heard what the issue is. You need to state what that issue is, and it needs to be relevant to the budget.
Okay, I continue. All I want to say on that point, Mr. President, is that members of the public should not go through and spread malicious falsehood and propaganda.
46-1, Mr. President.
What is going on?
He will not stop.
All right, okay,
Just
okay,
won't stop.
Senator Mark, all right. Before we get into no. So this process is starting to break down. Let me try and guide Senator Gopeesingh as to where this is going awry. So the context that you're trying to create and the statement that you're making is almost immediately creating an air of imputation before you make that statement. Like I said, I still have no clue what the issue is that you're alluding to, but you start off by indicating it's misleading. And to the average individual, given that this is a budgetary process led by specific individuals, it can be taken as imputation straight out the gate. So that's why I'm saying it has to be relevant to the budgetary process that's in front of us. And you have to be careful when creating that context and the connection to that budgetary process. Understood?
Mr. Honorable President, I will close that point and say that based on the falsehood that have been perpetrated, the honorable leader of the opposition is quite fit and healthy and strong. There has been no amputation.
Senator, have a seat. Members, I'll try again. And I will choose my words carefully. You cannot begin by imputing. So, my advice at this point in time, just move to the next point. Don't even close off that one. Just leave it, move to the next point.
Mr. Honorable President, that the leader of the opposition is strong, fit, healthy, and raring to go. I want to move to the next point. The next point, I want to follow up on what Senator Timal spoke about earlier. And that is the desecration of what he spoke about. I want to quote from the newspaper today, Daily Express, Tuesday, 24th October. The desecration of a Hindu effigy last Sunday is a twist on previous incidents of desecration involving mandirs and other places of worship. The effigy of the Hindu demon King Ravan was to be erected at the Turuba Ramlila ground in Marabella, but unknown individuals set fire to the structure on Sunday morning. Ramlila celebrations have been taking place at this location for over half a century. And the organizers say this is the first such occurrence they have ever had. I expected the Honorable Senator Sagram Singh Suklal, who is a Hindu, would have spoken about it and condemned what has happened, but obviously she belongs to a government that has failed to condemn these acts of perpetration of desecration. Senator Timal condemned it. I, on behalf of the opposition, condemn these acts of desecration. And we call upon the PNM government to also condemn it. And they failed to do so, and we listen to see whether the Honorable Prime Minister will condemn it, or the Minister of National Security will condemn it. So, I want to just continue for a minute on this. However, this attack is in line with previous cases where mandirs and churches have been desecrated. In September last year, temples at Penal and Kali Bay were vandalized, as was another mandir in Williamsville last month. So, Mr. President, you have these acts being acts of vandalism, indicating a new wave of activism amongst them, as stated in the editorial. As regards the first, The police have basically made no headway into any of these incidents. We call on the Minister of National Security to direct his team to search into what has happened and come up as quickly as possible with the answers and ensure that there are strict penalties for desecration of these religious practices and rites. The Ram Leela is a sacred event in Hinduism, signifying the triumph of good over evil, and should be respected as such. This is the editorial of today's Express. Desecration can metastasize, spread, my colleagues, into more violent acts. The trend must therefore be to nip it in the bud, starting with the police finding suspects and making arrests. So we call on the government, Mr. Honorable President, to immediately condemn these acts of desecration and to immediately go in search of those who continue to commit these rights, these acts of dirtiness against religious organizations. Mr. Honorable President,
Thank you, yesterday.
on the newspaper as well, do Trinidadians respect each other's religious beliefs? And there are lots of comments on this. So this is of national importance, and this is of importance for the government's consideration. And I ask the government, what are your views on this, and what are your statements on this? We on this side condemn these acts of perpetration. And the Constitution, Mr. Honorable President, the Constitution the Constitution of the Republic of Trinidad and Tobago. And it says in Chapter 1, the recognition and protection of fundamental human rights and freedoms. It is hereby recognized and declared that in Trinidad and Tobago, they have existed and shall continue to exist without of rights and discrimination by reason of race, origin, color, religion, or sex. The freedoms following fundamental human rights and freedoms, namely the right of the individual to life, liberty, security of the person, and enjoyment of property, and the right not to be deprived of thereof by due process of law. And C, the right of the individual to respect for his private and family life. And most important, H, freedom of conscience and religious belief and observance. It's in the Constitution, Mr. Speaker. And every religious body has a right to continue and perpetuate their own religious beliefs and customs in freedom as defined in the Constitution. So this is a constitutional issue, Mr. Honorable President, and there's silence, marked silence on this part of the government. And we can ask the question, is there something deliberate in this?
No.
46-6.
Senator Mark, the two of you, I'm not, that's it. I'm not going to raise to my legs to treat with a point of order and have to ask members to be quiet. The next time I have to do that, I'll just be taking action. Senator, you cannot impute improper motives along the context of what you just generated. I get the point that you're responding to and reinforcing what has already been stated by Senator Timal. That point has been made. I'm indicating to you that you've gone too far in that, which means that you're no longer reinforcing what Senator Timal has said, but you've gone further and crossing a particular line. Senator, continue. Stay away from imputing improper motives.
I don't think that I've ventured there, Mr. Honorable President. I don't think that all I'm saying, it is a society we live in now, and we have to be very careful about what is happening. And so we raise and alert the national community with things that are occurring, which are not right and which are not proper. And the government has a responsibility to speak about it and condemn these acts of desecration. So the Minister of Finance wants me to speak about the budget. I'll speak on it now. So I will touch on two areas of health and education if I have the time. So two of the sectors of major concern to every single citizen of Trinidad and Tobago, health and education, which are two of my own, I would say, areas of expertise. I mean, I've been a lecturer at the university for over 35 years, and I've trained almost 3,500 young doctors and about 50 to 100 postgraduates. So my colleagues will know that, and my colleague, the leader of the opposition, he was my student as well. I respect him, I honor him, he's doing a great job, and we are great friends. In this budget, Mr. Honorable President, out of an overall allocation of $57 billion, the Honorable Minister of Finance has allocated approximately $8 billion to the health sector and $7 billion to education. So about $15 billion have been allocated to these two ministries, which is about 27% of the budget out of $57 million. So over the last 8 years, over $114 billion have been spent in these two sectors, which is approximately out of every $4 spent by this government have been spent on health and education. But when we ask, is there anything tangible that they can show for it? You search for the last 8 years to see what has happened in education and in health, and both sectors of education and health have been crumbling, have been decaying, and have becoming worse, Honorable President. Over the last 8 years, the health sector has deteriorated tremendously. And so when the finance minister, in his delivering his night budget presentation for over 4 hours in the other place, I realized that he spoke to the health sector for just about 6 minutes in his 137-page speech. The minister dedicated just about 700 words to the health sector, and this is after spending approximately $56 billion on the health sector in the past 8 years, because he has nothing good to say about it. He can't show that they have done anything. He knows in his own brain that they have failed the country, they have failed the citizens of Trinidad and Tobago. And so the worst state of the health sector now is in our nation's history, with broken promises. Mr. President, I make no apologies for saying that today the health sector and healthcare management are the worst ever in the history of Trinidad and Tobago. The facts indicate that our hospitals have now been turned into disaster zones for healthcare, where patients are dying from preventable causes because of mismanagement, inefficiency, and incapacity and incapability under this government. And of course, supervised by the Honorable Minister of Health, who is now being fossilized in the 8 years that he has been Minister of Health. He lacks any vision. He lives in the past. And I would say boldly, he doesn't know one iota of what health care management, because he has failed from day one and failed after 8 years. And I will come to some of the things. So over the past 8 years, somebody just indicated that he failed in 2 pharmacies. Our citizens have been entering hospitals as patients and emerging as corpses. So many families have had to suffer the immense pain of losing their loved ones in the very place that is supposed to cure them. That it is not only heartbreaking, but frankly inhumane. And every year, including this one, their budgets are consistently filled with failed and rehashed promises of yesteryear and no tangible measures to improve the quality of life. They said in 2016, Honorable President, that the government will expedite surgeries. That was 7 years ago. Today, thousands of patients across the length and breadth of Trinidad and Tobago are waiting for their surgeries to be performed, even basic surgeries, things like breast lump biopsy, things like a little hernia operation. They have to wait 2 to 3 years to have this done. People are waiting 2 years for clinic appointments. What type of health care are we providing? My colleagues and we have been through the health system. We worked in hospitals. And what we are seeing now is a direct contrast to what we used to do in the hospitals. Look after patients, work with the patients. It is not happening now because of absent leadership and bad management It is not for the lack of funding. It is because of incapacity and mismanagement in the health sector. And hundreds, look in South, my colleagues the other day mentioned hundreds are waiting for cataract surgery. Cataract surgery could be done in 10 minutes. And one simple machine that is cost, no cost to it at all, no big set of money to spend, a phaco-emulsifier. A phaco-emulsifier is a little apparatus that sucks out the lens, the cataract lens from your eye, and if you don't have that, you could create damage to the entire eye. So they've been waiting for that for 4 years, and the operations are not being done and postponed. There are critical shortage of CDAP drugs in budget 2016. They promised to expand the CDAP program. Today, however, over 200,000 patients and citizens must endure a critical shortage of drugs and medical supplies. The reality is that most of these drugs, I spoke with a pharmacist today, one of the 250 pharmacists, over 10 out of the 50 drugs that are on the CDAP program are absent and patients cannot get them. So what is happening to the 200,000 plus citizens who depend on the CDAP program for their drugs and can't get them? They become sick, they become unhealthy, the complications worsen, and eventually they die. And it's basic things like diabetes and hypertension. And we asked the Honorable Minister of Health a few years ago, is he going to change the medication for the treatment of diabetes and hypertension? He promised to do it a few years ago, and today nothing has happened. So our patients are receiving pharmaceuticals that not as effective and efficacious as they ought to be, and therefore complications are arising. There are insufficient and inadequate surgical supplies, Honorable President, for things like orthopedics and neurosurgical procedures. Doctors now, consultants working in the hospital, the regional health authorities are buying these drugs from these supplies from these doctors. So when one orthopedic surgeon gets the equipment from another orthopedic surgeon supplied, he doesn't want to do the procedure. There's conflict of interest. And this has to be looked at right and nipped in the bud immediately. So patients are waiting for K nails for the femoral fracture and for ankle surgery to be done and so on, and can't get the equipment and the supplies that needed to be done. In neurosurgery, you have to buy a whole set of aneurysm clips when you have to do a neurosurgical procedure. I remember when I was chairman of the Northwest Regional Health Authority and Central Regional Authority in 1997 to 2000, I was doing surgery myself, and the nurse told me Dr. Gopeesingh Port of Spain Hospital is on the line. I said, I'll take the message. They said the neurosurgeon is asking whether to buy an aneurysm clip because he's in a brain and has to clip an aneurysm. I said, where is he going to get it? He said, well, one of the local places that supply. I said, what's it cost? I'm doing surgery, but the nurses, they said 180-something thousand. So if he doesn't get that clip, a patient will die. So I said, go ahead, buy the entire thing, but the others could have been used subsequently. But these things are not present in the hospital. These surgical supplies and so on are not there. So people are not getting the type of attention and medical treatment. Look at chemotherapy. I'm an oncologist since 1988. I was the first Caribbean gynae oncologist from 1988 until Dr. Narayan Singh came in 2003. My colleagues know that. I was trained at Princess Margaret Hospital for a year in 5 of the hospitals in Canada. In fact, Mr. President, I mean, there's no boast. I've worked and trained in about 18 hospitals around the world and have trained at 4 universities. So when I speak today, the Prime Minister recognizes that, and he said that to Dr. Gopeesingh. And it's not, I mean, I'm senior now. I don't need any accolades or anything, but I'm a senior person. I want to see the health sector good. I don't want to see any of my colleagues having to suffer. Sometimes they call me, and I have to try to help, despite the fact I'm not in the health system. So when I speak on health and so on, I speak with some degree of authority and knowledge, and we are there to help all people of Trinidad and Tobago. No one must suffer needlessly. And you know, Honorable President, when they talk about this parallel healthcare system during the COVID thing, that has been a failure. Parallel, nothing, paralleling what? Parallel is two lines vertically or two lines across. But it means then that the main system has to be working well, and that wasn't working well, so they could say they parallel that because they parallel incompetence and something not working. Yeah, incompetence paralleled. Patients were waiting for surgical procedures and were not getting it. Some of them died waiting for the surgical procedures for particular things like cancer, things like heart surgery, breast lumps and all of that. They were not getting it. So they were suffering and dying. And now, Mr. Honorable President, we have 10 hospitals in Trinidad, 9 district health facilities which are supposed to be open 24 hours a day, 105 health centers. We have 10 private hospitals, nursing homes, which are of high standard. Why should people have to be lining up in an emergency department on trolleys and on wheelchairs for 3 days, waiting to be attended to? The doctors and nurses, and they try their best, but the system defeats them. Because when you have patients waiting on trolleys and can't get a bed in the wards to transfer these patients, or can't go to the centers where they will do the interventional treatment and surgery, the whole accident emergency is filled. And people die after waiting 2 to 3 days on trolleys and on wheelchairs. Honorable President, I invite any one of you here today to go to Port of Spain General Hospital Emergency Department. And when you see the overcrowding and people on trolleys crowded together, and you hear them crying, nurse, nurse, doctor, doctor, are thirsty. And then some of these elderly citizens just die in the emergency department. How painful it is. They're dying there in the emergency department, 50 of them crowded together. This is why I said the Minister of Health has failed, and this government has failed badly on the health sector management in this country. And they continue with the broken universal health insurance promise. Since 2016, they promised universal health insurance, saying that by December 1st, 2018, a national health insurance system will be in place and operational. That come and gone. 2017, they said the same thing. The government will collaborate with private sector investors for the most appropriate health insurance model. 2018 came and went with no national health insurance. 2023 today, 5 years after they started speaking about it, no national health insurance. In 2019, they rehashed the same promise, saying our goal of achieving health coverage is quickly becoming within our reach, with every citizen having access to first-class health care, with specialist health services being provided. To date, nothing, Honorable President. Yet another PNM rehashed broken promise. And today, I just saw on the National Daily Express big plans for Central Block. They are saying facility to train specialist doctors. Yeah. Mr. President, Couva Children's Hospital and multi-training facility has been there from 2015, 8 years now, where this government could have started the training of specialists and subspecialists by working with international institutions. I recommend to this government now to begin some talks with Mount Sinai Hospital, MD Anderson, Texas Cancer Center, Johns Hopkins University, University of Miami Cancer Sylvester Institute, to begin some discussions and use Couva Hospital as a center of excellence for cases of cancer, orthopedics, neurosurgery, and some renal dialysis. Instead of having all these things, orthopedics, neurosurgery in the 4 different hospitals across Trinidad and Tobago, bring them under one umbrella. So the citizens know if you have an orthopedic problem or a neurosurgical problem, you go to the Couva Hospital. But for spite and malice, anything that the UNC brought and produced, they decided they're not going to open it. 8 years, this population should, they have stifled this population. They have dealt a serious blow to this population. 8 years, an institution which has some of the best equipment you will get in the world.
Senator, you have 5 more minutes.
Wow. Wow. Some of the best systems in the world and best best equipment have been laid to waste. So let me just deal with this thing, what I saw in the newspaper. I could have gone on to tell you about the achievements of the partnership government from 2010 to 2015. It is on social media, 421 pages of the People's Partnership Government achievements, and I could send them a copy of our achievements in the health sector. And most important, is the Children's Life Fund. That was the second cabinet note that the Honorable Prime Minister at that time in 2010 brought forward for approval. And the Children's Life Fund, where the Prime Minister contributed 10% of her salary and ministers contributed 5% of their salary for 5 years, 135 infants' lives were saved during a 3-year period. So, Honorable President, I want to just read what Minister Diyal Singh said. He said, currently, specialist doctors got their training from abroad. We have 20 specialist areas in Trinidad for the DM, the Doctorate of Medicine. I trained 2 of them in obstetrics and gynecology in the 1980s for their Doctorate of Medicine. There are 20 disciplines, but they have now been reduced because they're not getting the support of the government. And so they have had to curtail the amount of DM programs, the doctorate programs. So what is he talking about going abroad? We have it here. But you want to develop specialists. The doctors have to start from an intern to a house officer to a junior registrar to a registrar in their training program to become a consultant. It takes 6 years. And you have 400 plus young doctors without jobs wanting to come into the hospital system and unable to get a job. Some of them in selling gasoline, some begging for jobs in the private nursing homes. And you're talking about specialists. But you had Hoover Hospital to do all the specialist training for years. For 8 years, you didn't do anything with it. And you're now talking about having Port of Spain Hospital as a training center and having specialist training. No, trying to fool the population again, myopic in the vision. And the honorable member, the Senator Jolene John, with Judicot, signed a memorandum of agreement with a British organization, a British firm, in fact, a government-to-government, let me just see if I can find it, for Port of Spain Hospital. It's a memorandum of understanding between the government of the UK and Great Britain and Northern Ireland and the government of the Republic of Trinidad and Tobago for the healthcare sector of Trinidad and Tobago, signed Port of Spain 28th day of October in the year 2013 in duplicate, and signing at His Excellency Arthur Snell, British High Commissioner, and the Honourable Winston Dukran, Minister of Foreign Affairs. And the priority project identified under the signed government framework was a turnkey redevelopment of the existing 560-bed Port of Spain Hospital into a 750-bed medical campus with an international medical training center identified by the government of Trinidad and Tobago. And they had the scope of the turnkey hospital project. And that was going to take 5 years if we had been retained in government, 2015 to 2020. That would have been finished. Now this central block at Port of Spain Hospital was given to Shanghai Corporation in 2019. It's supposed to finish in 27 months. And still today, the Honourable Minister of Health and the Prime Minister talking about the completion of the central block in 2025. And we will be back in government and we'll have to finish the work at the central block of Port of Spain Hospital. Mr. Honourable President, there's much more for me to say, but I want to just conclude by saying that
Senator, your time is expired.
all right, okay.
Thank you.
Thank you.